Students in our area kicking off another school year. New York City public school students have their first day next week. Some school districts are already back in session.
Right.
Can you believe it?
Yeah. I know. I can't. But I know some parents are welcoming it. Yeah. It is the perfect time, though, for tips for parents to make sure that everyone is ready to get back to school. We definitely want to start on the right foot. Yeah. Keep it smooth. So ABC News medical correspondent Dr. Darian Sutton joins us with some important reminders.
I love the start of school.
I love it, and I love that you're always here when we need some advice. You have been making the rounds here at WBC. I love it. So of course I got a call from Nurse Julie yesterday to make sure that we got the physicals and the exams. So because you can't get into public school without that. Yeah. But another thing in terms of preparation, making sure your kids get back in a routine for wanting to learn and sleep. Absolutely. To me, that's like the most pressing thing right now, making sure your kids are getting that, 10 hours?
10 hours, sometimes up to 12 hours of sleep. But just to take a step back, making sure that everyone understands those vaccination updates are really important. Yeah. We're moving into this viral season, more likely to see COVID, flu, among other viral infections, even sore throats, as well as making sure that their vision and their hearing is checked. That also includes adults as well. Sure. We should get our vision checked every 2 years. Just because your vision was great in your 20s doesn't mean that it stays good. But it benefits you. It benefits you. And then remembering to get that annual physical, of course, for everyone.
Yeah,
and
because
then beyond that.
Again, in public school, you can't even enter the building if you're not up to par.
Yeah, so. And you will probably leave with some type of infection if you don't. Yeah. Levels of whooping cough, which is a viral infection that causes this nasty cough, are 3 times the level this year than they were last year, returning to pre-pandemic levels. So just a reminder, that's a part of those routine vaccinations, and that is what that prevents.
Okay, so we talked a few minutes ago, earlier in the newscast, about cell phones in schools. Yeah. It's a huge talker right now. We're hearing from some of the school officials trying to set rules and regulations, but I want to hear from the doctor. You know, what is considered safe when it comes to screen time for the kids, ages maybe that are appropriate for these kids to have phones?
It can be difficult because screens are everywhere. I'm a proponent of making sure that we eliminate screens in school time, because I can't imagine how distracted I would be if I had my phone with me while trying to learn basic math. So a reminder that we should probably advise kids to not use their phones at school regardless. Now, what is that recommendation for screen time? For children between the ages of 7 to 9, 2 to 3 hours a day, this is what we're talking about. What is the word that I'm looking for? We're talking about entertainment, not education.
Sure. Okay, because I'm glad you made that distinction.
You saw how I was trying to make sure
because they use that as part of the curriculum.
It is.
Screens.
Yeah, and the screens, that's what we're talking about, focusing on the screen use for entertainment. When you're done with your schoolwork, obviously screens are everywhere. And then for adults, trying to keep that under 2 hours a day, now that is difficult because I looked at my screen time and I definitely put the phone down after it because mine is a little too high.
No, I think you're totally right. So, you know, even before, like, let's say New York City Mayor Adams and his administration figures out a new rule for banning cell phones or limiting that, I think that parents should get ahead of the game with their kids.
We've seen studies that show that when parents are more on their screens, kids are more likely to have anxiety, mental health effects. So it's important. Kids are paying attention just
lead
as much
by
as
example.
You are.
Yeah, I started noticing my son, he's 3 months and he's already starting to look at the TV.
No!
So I have to now I block him purposely, or if I have my cell phone or I see him kind of looking, I'll put it down.
Or like have a nice novel open.
Unless it's this show. Unless it's this show.
Unless
you just
it's
replay
this
the show over again.
Then we do. Now stick around because I do want to talk about this new advisory that was put out. There's a new advisory on mental health and well-being of parents from the U.S. General Surgeon. According to the advisory, 48% of parents say that most days their stress is completely overwhelming. Parents also report feeling lonelier than other adults. These are parents, I would imagine, people without kids in comparison. So what do you make of this new advisory?
Well, I take these seriously because advisories from the Surgeon General are more than just a simple advisory. They are identifying something significant in public health. An estimated 50 million people in this country are having kids under the age of 18, and that provides tremendous stress. And then when they're not allowed to have breaks from jobs where they can come back to that job after that child is sick or that family member is sick, they're less likely to keep their job. And from a business perspective, that makes it less likely, that decreases their economic earnings. That's worse for the economy. But more importantly, when you're able to stay at home with your child, that's important. That's critical for those times, for that child to grow and succeed. So I agree with the Surgeon General's push to have policies that support parents, because that is necessary to keep this economy and the society going.
Such great advice.
Well, that advisory is part of the Our America Mental State, the Loneliness Epidemic series. The collaboration between ABC News and ABC-owned television stations aims to share reporting on how to build social connections. It's so important to health, right? Learn how you can take action by heading to abc7ny.com/mental state. Dr. Sutton, thank you for joining us. I think it's so funny that you get excited about back to school. Thank goodness, because you went to enough of it, right?
My favorite day is the first day. I still remember laying out my outfit.
I love it. You're still not jaded. There's hope for us all.
There is.
Thank you for being here.
Of course.